Hi, I'm Dr. Johnny. Today we're talking about the #1 PDO thread complication. So I get a lot of direct messages every day about complications of different things from filler to toxin to PDO threads. And the #1 PDO complication that people ask me about that they struggle with is puckering of the thread. And if you're a patient and you had it, I know it can be frustrating. And for those doing a lot of threads, it's part of what you're going to find. If you don't see complications, it's because you're not doing enough procedures, whether it's fillers, toxins, threads, or anything else you do. There's a bit of a numbers game, certainly a training game, a patient selection game, but also a numbers game. And so having complications or side effects is a normal part of everything. If you look at the studies of approval for neuromodulators, for fillers, you're going to see side effects and complications there too. So everything has them, but the #1 I get asked for threads, of course, is the puckering. And this is what it looks like. It's an irregularity. A lot of times it's with dynamics, so it's only seen when people are smiling or moving in certain ways, but it can be troublesome. And we'd be remiss without mentioning, first off, there's PCL threads, polycaprolactone, which last a little longer than the PDO, polydioxanone. There's PLLA threads, which are in between that for duration. And then there's polypropylene, which are permanent, which we don't see a lot of in this country, in North America anymore. And of course, permanent threads come with permanent products. And the reason I bring it up is, remember that puckering and all these side effects to do with puckering irregularities, they go away on their own. That's the good news. People lose their mind if they have the complication, and they're very frustrated with it for what it lasts, which is typically no more than 3 weeks to 3 months. So the good news, no matter what you do, if it's PDO, PCL, which will last longer, or PLLA, it's going to get better. But there are interventions that you can do to get rid of them, but what are the top few things that cause them? If you like these videos, click like. It helps build our community here. And remember to subscribe. You'll be alerted for all the newest and latest innovative videos I do. And click the bell, because then YouTube will notify you when the new ones are there, and you can be among the first to watch them. #1 is doing a thread lift on a patient that's not an appropriate patient. In other words, they should have had a facelift. There's too much loose skin. And so you're trying to lift and drape it, but where? Where is it going to go? And we would see this most commonly when we started doing threads on the body, particularly the buttock and buttock lifts. People who are of older age or poor skin quality would try and get them, and you would just see, because we use big threads, you would see the skin just draping off them. The same thing happens with the face. So that would be the #1, too much loose skin. The second one's going to be poor skin quality. If the skin is too thin, you typically don't see a thread. I've rarely have ever seen that. But if the skin isn't strong and robust, then as they move, as they're dynamic, it will come to the surface. Another reason is the post-care. They didn't take care of the thread afterwards. There was too much movement, too much dynamics, and the thread over a week or two worked its way to the surface. And that's another common reason to cause. In terms of the injector or the person doing it, the #1 thing I see there with technique is when patients, or when the injector takes a vector and they start going and they go, oh, I'm going a little bit the wrong way, and they readjust and they keep going. That readjustment creates a little loop, and that loop works its way superficial. So the #1 injector area, other than wrong patient selection, too thin skin, too much loose skin, is redirecting the thread. Another cause would be just using poor threads. Threads, when they're exposed to the environment, if they're older, if they've been shipped in the wrong temperatures, and I have threads in my practice that I put in water, acid solutions, bases. I'm always testing them to see what's going to break the thread down. But different threads from different companies, and depending how long it took to get to the practitioner, they can crumble in your hands. Some of the threads are too strong and robust. In America, people want the thread lift, and so they're using the biggest bar, best thread to lift faces that really need a facelift, and they're not using smooths enough. And smooth threads are underutilized, but when you go always to barbed threads because you want that lift or that snatched look, you're going to run into using the threads in the wrong application. So not using enough smooth threads and always using barbs no matter what the patient. But the use of the thread often depends on, guess what, the thread itself. So choose your threads carefully. I have a whole video on how to choose your threads, and I'll post that at the end. So that's puckering. How do you treat it? I have a whole video on how to treat complications of PDO threads, so you can watch that. I'll put a link below, and I'll also put it on the end screen, and you can watch how you might treat these complications. So let us know, have you ever had a puckering of a thread? Are you a patient that experienced it? What do you think the causes are, and how do you get rid of it? If you like these videos, click like, certainly subscribe. It helps build our community here. And join me, click the bell so you're notified of all our upcoming videos to keep your skin and body beautiful, healthy, and vibrant.